PGI. So, from PGI, yeah. So, his article, and there are in every issue of National Medical Journal, if you see in letter section, Professor Mani, who is a well-known authority in this field, continues to write. You must really admire his understanding in this field and his interest to continue to write in the interest of the recipients, donors in the society, in the law and ethics. So, it is really interesting, and every issue has a letter from Chennai. Dr. Mani writes about how these things are happening and how as professionals we must take care of these aspects. The next one is related unconventional. Unconventional is wife, husband and uncles. This is unconventional. That is where lot of ethical issues come up. Are they really related, not related? What is altruism? Are there any gains? There can be a real altruism, because relationship and altruism, they are independent. Related people need not be altruistic, or unrelated people may be better altruistic. So, they may be totally unrelated. It may be there, it may not be there, and sometimes in unconventional, for example, I had a couple of cases where a person will come and he says she is my sister and she wants to donate the kidney to her husband, and how do you establish that person who has brought her, is he the brother? So, there are many such kind of issues will be there in assessing the unconventional kind of, they will produce any kind of certificate, photographs and all. It is extremely difficult. And related and altruism, this is where I mentioned that there is they do not go hand in hand. So, people may be unrelated and they may be altruistic, and in order to solve this problem, there is some kind of an indirect altruism concept has come. For example, I donate the kidney to somebody, not with the gain that I should get back something from him, but I have some kind of condition, you help somebody who is poor. It is something like I give blood to somebody, you do not have to give me blood, you give blood to somebody who is in need. This is an indirect kind of an altruism, which in developing countries people have evolved, and they say that what is wrong in that, and what is wrong in even getting the money, but even people are debating at that level. Other issues, spectrum of cases, varieties of cases. So, one case is not similar like the next case, particularly when you look into psychosocial and other kind of factors, and there are soft and hard positions. Many times we have to tell no, and there are sometimes it is very easy, in 2 minutes we decide okay, this is fine. Okay. So, we have to be aware of this whole spectrum. There are loopholes in Human Organ Transplant Act 1994, particularly about relatedness, genetic, HLA or unrelated, these kind of issues. Problems and risks like cross checking and lies come across. Difficulty in cross checking and how to pick up the lie is a problem. False justification, people ultimately justify, even I may justify saying that it is okay, what I have done in good faith and it is fine, or the treating team or surgeon. So, they falsely justify ultimately once. That is one of the problem in compromising the clinical ethics. Adverse publicity, which can happen in these kind of questions, like what is altruism and what it is in our language. If you ask in Kannada, which is my mother tongue, paropakara bhavane, something like this. So, what exactly altruism in Hindi? So, I have asked one of the leading nephrologists and asked, I tried to send some of these questions to a couple of people. These are the questions I have asked them, and I will just read some of them because of want of time. So, he said in Hindi, Mahanata, Manushyatva, even these words are not exactly altruism. How to elicit altruism in organ donation? One of the answer is to rule out financial potential gains, to assess financial and other vulnerability, giving wrong information to prove altruism is common, hence to look for wrong information. So, this is one of the answers given by a well-known nephrologist. False indicators of presence of altruism, wrong address, wrong or false documents to prove relationship. Is altruism absent when there is material benefit? Yes, altruism may exist when there is compensation, but the boundary between compensation and material gains is very slippery. You have to keep that in mind. How relationship is defined in HOTA 94, mother, father, son, daughter, brother, sister, wife, husband, but wife, husband again is unconventional, outside the close relation. How to reduce evil of organ trade? Counseling sessions with recipient, donor, family, most important, most time consuming, sometimes rewarding. Scrutiny of address, ration card, In doubtful case, wait, reassess after 1 to 2 months. This is a very good suggestion. So, do not just you say you come back after some time, we will reevaluate. So, I will just go to some of these questions quickly and leave it for the audience to keep thinking and try to answer, and then look at what the literature says, what in your experience you have, and what the people who are actively involved in that, how they answer this question. Relationship and altruism, are they related? They are not related. How to reduce bias in assessing altruism? What are ideal or mandatory assessments? How to assess conflict of interest, both in the treating team as well as the donor and recipient? Reappeal for assessment, if it is rejected, do they have a right to reappeal, or how you assess that? And many more questions. These are some of the questions I picked it up. Summary: intertwining medical, psychiatric, psychosocial, ethical, and many more. It is very complex area. Consultation lies in role. Me as a mental health professional, I have some amount of understanding and limitation, because I work only in one part of the whole exercise. So, I am involved in pre, peri and post operative method. Like today, I have to immediately after this talk, I have to go to the nephrology ward and see 2 patients. One patient, they have said, is a diabetes, hypertension, end stage renal disease, prospective renal recipient, has uncontrolled sugars, BP, kindly assess for drug compliance. That means, if he is not drug compliant, will he be compliant after transplantation? So, I have to see this patient. So, another patient, one of our patient currently not for transplantation, on dialysis, and then very disturbed and delirious, who tried to pull out his tube recently. He was bleeding and they had to arrange for blood, and that is a behavioral aspects. So, in a consultation, rise and roll is continuous pre, perioperative and post-operative period, trying to look at the quality of life, how we can improve that. So, altruism is independent of relationship. This we have to keep it in mind. Look for inconsistencies in the information. So, you have to have a team. The inconsistency will not occur only to you. So, only if they have seen by many people, then you can pick up the inconsistencies. No proxy decision making for the patients. So, as a doctor, we should not get involved, it is okay. So, must try to avoid, even as a relative, not to give a proxy decision making. No counseling skills to influence decision of donor in the matter. As clinicians, sometimes we may be excellent in counseling and shift and manipulate and use our clinical counseling skills to influence the decision making and land up in difficulty. Clinical and moral independence with compassion and respect to the donor. So, I should not take a moral stand, and I should be clinically independent. I should not get involved with the transplant team and other kind of thing. So, it is very difficult exercise in the mind for us. So, how to keep off, continue to even weigh the compassion, because compassion is in the forefront, it immediately comes, but then it biases other aspects, and respect to the donor, because do not suspect every donor after you read the newspaper. Unethical answering cost and complications, refer to other source, this is unethical. Suppose I am in the ethical team, I have been asked to do the job of only to check whether are they related, is there any altruistic donation. But in the discussion, if I start getting involved with the patient, and if I tell him, why are you getting it done, why do not you go there, and I know some other person and he will do it better, or he will do it cheaper and the cost is less. So, I am already transgressed the unethical area. So, I have to keep myself during this interview that I am absolutely ethical. Some of these questions I will say, I do not know, you go and ask your primary physician who has suggested this intervention. Protect vulnerable members of our society, very young, old, physically and mentally infirm, institutionalized members, poor and females. Particularly in our country, if you look at the data, who are the large number of donors, they are all females. An unrelated donor, who are large number of people, they are all from slum and poverty. If you read most of these articles by Dr. Mani, he says there is something peculiar to our country, and there is a need to look into this, why people are not coming from other kind of sectors. Never allow his or her personal desires, needs, feelings, prejudices, beliefs to interfere with the assessment. That is a difficult thing. That is a difficult thing. So, in conclusion, promote cadaver program. One of the answer for this, if you want to really reduce these kind of adverse publicity against the doctors who are working in the front line of advances in science. So, one of the thing which helps is promoting cadaver program, support and develop HOTA, like continue to develop, continue to debate, continue to revalidate HOTA Act of 1994, check unethical practices by whatever way one can, develop teamwork and collective decision making process. Thank you very much. So, I thank the organizers, Dr. Ravindran, for having given me this opportunity. Thank you very much.
Sir, this is regarding the cornea transplant.
Corneal transplant.
Cornea transplant. If a doctor has patients in the middle age group waiting for cornea transplantation, and about 6 persons die in the road accident, and they are brought dead to the hospital, since cornea has to be taken out in a specific time period, if the doctor has the right to take the cornea and transplant it?
Legally not correct, clinically also not correct. So, you have basically faced 3 dilemmas: clinical, ethical, legal as doctor. So, I talked about clinical, tried to limit myself, although I talked about these and I could not answer some of the questions, they are legal. So, that requires a legal expert. So, clinically also it may not be correct. Maybe if a person is dead, it is our duty to talk to one of the closest relative who is related to that person, to take consent from them. And it may be much easier in corneal transplantation, because already the public awareness and these things have improved. We are much ahead compared to renal transplant, cardiac and hepatic, where many other complicated ethical issues come up. Because already it is accepted, people easily give consent, they do not ask many questions. Even then, like I said, supply and demand, if I look at, there is so much of demand, but supply is less. Supply is less, even in area like corneal transplantation. So, the much more difficulties are in the liver transplantation, particularly people, particularly for my specialty, if a person is an alcohol dependent, is a personality disorder, is an affective disorder, who has cirrhosis, and he can afford, and he has all the contacts, and he wants to get a living donor or a cadaveric donor. So, whether to allow this, because if he is going to drink again and spoil that, is it better to give to somebody else? So, there are very, very complicated ethical questions arise as you think of different organs and living or cadaveric transplantation.
Sir, one question, sir. If the husband and wife, the wife wants to donate to husband, their husband and wife proved on the certificate, what if it is for, like in other countries, you go for immigration, you get married to a girl and get the immigration. This can happen here also. Somebody could marry and say this is for organ transplant purpose. You will get this money, after that, finish. Is there any law there that it will remain husband and wife for so many years?
I don't think. Once you donate, you are bound to live with a person. So, then there is issue of voluntariness, human rights and these kind of things. I really don't know. There are cultural specific. This has to be answered. We cannot exactly compare 2 cultures. This is a culture. So, we have to frame our own rules and say we have to work within these boundaries of culture. But there are people who are in the boundary line of this culture. So, maybe we will have to have a different way of resolving that. Okay, sir. Thank you very much.